Good afternoon, everyone. It's just tripped over to 12 o'clock, so it is officially afternoon. Welcome to this week's Team SFH Brief. I'm Dave Selwyn, I'm the Acting Chief Executive. I am joined this week by Kerry Bosworth, our Freedom to Speak Up Guardian, by Claire Madon, our Chief Nursing Information Officer, and by Sally Palmer, our Nurse Consultant of IPC, or Infection Prevention and Control. Some of my favourite people to talk to. So you're all very welcome. So we're going to cover a number of topics today. We're going to talk about Freedom to Speak Up Month. We're going to talk about Digital Confidence Survey, and we're going to get a bit of an IPC update. But before we start that, I've got a few updates to give you. I'm under strict controls to keep to my script, which of course I won't do. So first thing is I put a bit of an update around Paul in the blog that I sent out last week. Do maintain regular contact with Paul, and so he does know that we are missing him, and just as soon as I've got more information, I'll start to share that through the channels. So continue to wish him well and look forward to seeing him when he's ready to come back. And then in terms of other updates, we've got the National Staff Survey. So the National Staff Survey is now live. It's now open. I've done mine. It's not too onerous. It is confidential. You will get reminders, but that is just the company picker who are sending you reminders. It's not us. So it runs for 8 weeks, all the way until the 29th of November. And the reason this is important is it's the way that you have a significant voice in our organisation. And Kerry's going to touch on the power of the voice and the power of speaking up. But it's a significant voice in the organisation. There are free text boxes. I do read the free text boxes. And we take those to heart when we see them, but it also just allows us to actually address areas where there are concerns that perhaps sometimes we aren't necessarily cited off. So I just encourage you to fill in your staff survey. Last year we had 62% of our workforce filled in the staff survey, so we'd love to hear from you. It may have gone to your junk email. It's linked to your ESR email, so it'll be if that's a personal one, it will go there, and if it's the work one, it'll go to work one. But just check your junk folder. If you don't have a survey, we can get you one sent, and Jess will spookily put something in the Q&A that tells you how you can contact the organisational development team to get a staff survey. And then, of course, we're doing a bit of a survey around the different divisions. So this week, I think it's corporate week, so we'll be shining a spotlight on some of our corporate teams. And as always, there are various treats and goodies up for grab in that. And then it's the Get Online week, 14th to the 20th of October. So we'll probably pick up some of this when we talk to Claire. But this is part of our commitment to becoming digitally enabled, digitally led trust. And during the week, lots of the members of the digital team will be around to help patients, help staff, empower their connectability and their healthcare by using digital services. So that's obviously the NHS app. 30 million logons a month now via the NHS app, not just in Nottinghamshire, that's countrywide. And also Patient Knows Best, which is one of the front end components, and that's where you can access your letters and your appointments and those sort of aspects. So we'll help you with that. There'll be a stand in the KTC from Monday this week all the way through to Friday, running 9 till 4. We can help sign up and also take any of your queries or questions. So we'll do that, and we can provide bespoke visits to departments or who need a bit of help, digital help. So and again, there is a link that we'll put in about who to contact. That's Amy from the digital team to help you with all of that. The next one's everyone's favorite, car parking. So we are starting to put the automatic number plate recognition cameras in. As you'll be aware, the barriers haven't been great for some time. And so half of them have been up and half of them haven't been down ever. So we're replacing them with automatic number plate recognition. But to do that, you will need to register your card. In other words, register your car. In other words, your number plate, so that we know that it's you. Because otherwise, I might trigger one of those nasty parking notices that we don't want. So there is going to be more detail coming out around this when the start date was this. Start date is happening with all of this, and how you need to register your car number plate. It's all going to be done online. The first number cameras we've put into the big car parks at the front, the patient visiting car parks, because we've had some real problems with members of our staff parking in the patient parking, and that means that our patients can't get into park. So those are going in first. So we'll put more details in that into the bulletins for you. Then this Friday, it's World Menopause Day, and still time to register for this. So we'll put the link for that into the chat as well. And bring this Friday, will bring a whole host of lived experiences and professional support to colleagues, providing guidance and tools to help those who are experiencing symptoms of the menopause. So it's 9 till 4:30. Join online or in person in Lecture Theatre 2 and in the Kingsmill Hospital in Newark boardroom. Can't get my words out today. Boardroom. And then probably the final thing is the reason I can't get my words out. I'm a bit tired. So we've put some communication around. Yesterday we had a bit of a funny day, to be fair. We had some rather unexpected communication into the organisation suggesting that we had some security issues, and so obviously we took advice from our colleagues in Nottinghamshire Police and various other specialised agencies and our security teams to just ensure that actually the safety of our patients, our staff and our organisation was as good as it could be. And you'll have seen probably yesterday afternoon and overnight increased security patrols just walking around the trust. So we escalated this, and we sort of held ourselves in pre-critical incident mode with this, but we didn't actually go into any sort of critical incident, but we did use all the various mechanisms to ensure that we ran this and the organisation was safe and our colleagues and the staff were safe. And we just continue to remind in these slightly troubling times that the world is in to just ask that people are vigilant. They challenge people who are acting suspiciously. They look for people who haven't got name badges on. All of those aspects. They recognise people if they're tailgating into secure areas. Just those simple things, and look out for all of those aspects of our safety. So I'll probably stop there and move on to what we're talking about. You can ask questions. I encourage you to ask questions in the chat. I can't really say much about the sort of security incidents because Jess will kick me off otherwise. But we'll obviously keep people updated. But we think that has all passed. So in terms of then today's running event, I've got Kerry here who's going to talk to us about Freedom Speak Up. Kerry, you're a Freedom Speak Up Guardian. What on earth is a Freedom Speak Up Guardian?
You mean you don't know? Yeah, thank you. So everybody might not have heard of Freedom Speak Up. I hope they have in this organisation. It's really well supported and published. But yeah, my role for the organisation is to listen to people's concerns in a safe space, and understand those concerns, and hopefully get them to a place, whether that's a person or a process, where those concerns can be followed up. So I'm almost like I describe myself as a little boat in a port. So, going from one island to the other. I'm sort of an enabler of people's concerns. So I'm not there to judge I'm not there to investigate, but I'm there to enable people's concerns be transported, if you like, to the right port, and hopefully that they will get some resolution for what their concerns are and some support. I think that sums it up what the Guardian role is in a nutshell. I'm here to sort of talk about Speak Up Month. I know we have a lot of activity and adverts for different weeks and themes and things. But October is always Speak Up Month. And as you said, as Dave mentioned, it coincides with the launch of the National Staff Survey. So actually this month's theme is actually the power of listening. So obviously filling in your survey is a way that somebody's listening to you. I often get people say, "Oh, what's the point? I'm not sure whether anything's done about it." But unless you actually do it, that information isn't coming in and is not being listened to. So it's a really good source of value that we can get that temperature check across the organisation about all those very specific questions. So that's a route of listening. So listening, I think, is a skill. Listening is very hard. I spend 99% of my day listening, and I've realized since I've been in this role how hard it is to do it well. It takes skills, it takes concentration, and you have to be in a good place to be able to listen to people. Otherwise, it's actually a barrier. Actually, if you're not doing it well, it's an absolute barrier. And I think in Freedom to Speak Up, people come to me because they've hit a barrier, whether that's they've tried to speak up and somebody's listened to them, but really hasn't got the point, or they've felt that they've listened to them but then they've heard nothing since that they spoke up about something, and that becomes a barrier for them, or they can't talk to certain people, behavior, personalities, whatever. So that's why people come to me. So actually, listening is very, very powerful. And I think people say to me, "Oh, well, what do I need to do?" But actually, it is a skill that needs to be practiced and grown. So actually, if you are anybody that's a line manager, whether you're line managing one or two people, or you've got a whole directorate to listen to, actually you need to be on point with your skills, because that creates a barrier first off if you're not doing it right and you're not doing it properly. And in an ideal world, we shouldn't have to have Freedom to Speak Up Guardians. So going back to what Dave said about what do we do? Well, in an ideal world, we wouldn't need them, because, people would be able to speak up, be heard, be thanked, and things followed up. We can't, obviously, managing expectations, everything can't be fixed that people speak up about, but actually it's about giving staff a voice so we can actually try and learn, whether that's learn to apologise or whether that's learn to improve. That's the gift of people giving you information. And so I say to anybody that listening out there that might be a line manager, or that might think, "Oh, actually, yeah, okay, that's an interesting point." You are that first port in receiving concerns. Do you know how to handle a concern appropriately, attentively, and how will you keep in touch with that person that spoke up? Because that's often often the thing that's very challenging. People need to go away, they need to fact find, they need to go and get some more information, they need to connect with people. But actually, how do you make sure that person that spoke up first is still actually there in the loop somewhere, so they know that actually something's happening? That's a really important thing, and something I hear quite a lot in speaking up. The other part of listening is listening to the silence. So I think, people speaking up is good. I think across the organisation, people are willing to have a conversation. I think we've done that quite well over the last few years in promoting that. But actually, there's a lot of people that don't speak and don't fill in their staff surveys. And, actually looking around your team, can you spot that person that is quiet? Because actually you need to go and listen to that silence. You need to go and ask them, check it. It might just be they're having a bad day and a bit tired, a bit like Dave said, he's a bit tired today. But actually it could be that they're the sort of person that's got something that they need encouragement to have that conversation with, and you can't rely on them having, taking those first steps. So actually listening to the silence is really important. And then when you do listen to somebody, the other point of listening is listen with curiosity, not defense. I think that hit me when I first started doing this job, and I, was trying to sort of upskill myself and do all sorts of bits and bobs, that actually that phrase stuck with me. Listen with curiosity, not defending, because you get into that trick of listening, thinking, right, I know I'm gonna say that because they've just said that, so I'm going to reply to that and answer that. But actually that stops you listening, and actually the curiousness of what people are talking about is actually getting to the root of it and showing empathy and compassion. So they're the elements of listening that I think we're focusing on this month. The other bits about Speak Up is this is the time when I try and come to meet teams that I've not met before, or it might be you've had me down there as a team and you want me to revisit because something's not changed, or you just feel that you want to see me. It'd be nice to be seen, for happy things. But anyway, so yeah, if you get in touch with me, I'll come down and visit your team. I'll come and visit your office. I can work over the 3 sites. It doesn't matter. I was over on Newark on Friday and had some really good conversations. So thank you for the people at Newark last week that were chatting to me. And as I say, hopefully I'm, pushing this listening aspect of how we can listen better. So I think that's it in a nutshell, Dave.
Brilliant, really clear. So I liked that, listening to the silence. Thought that was a powerful statement. Listening with curiosity, active listening. Again, it's a real skill that we need to develop. I think that's a Michael West phrase. But if you want a good book to read on compassionate leadership, read Michael West. It's reasonably easy reading for a book. So what sort of things do people raise then, Kerry? And then that's my first question. While I wait for people to put questions in the chat, and what sort of percentage get satisfied or resolution with when they've raised it?
Yeah. So this is all very personal. So as in, for example, 2 people may come with exactly the same concern. They might work in exactly the same team. And there isn't a process that means that, right, this is what's going to happen and this is the outcome that we're going to achieve. So actually that conversation is about what that person is happy to do, feels safe to do, and actually comes up with a resolution. So for example, if we're talking about behavioural concerns, which is what I get a lot of, so that's people, inappropriate behaviours, care values, it's having an effect on their mental health, their well-being, their health, etc., all those sort of things. We could have 2 people with exactly the same things, but exactly what path is taken from there is up to that individual. So one person might want a full-on apology and an investigation in it, and another person might just want to talk about it and say, this is how it's affected me, and they may want support with their health. It could be, occupational health, all of our health and well-being offers, and that might be where that person goes. So the thing is, it's about what that individual wants. It's not me saying, right, I'm going to run off, into the distance with this concern, and I think this should be done and done about it. So in terms of what people speak up about, a lot of that is, like I've mentioned, behaviours. Our biggest pot of concerns is about the safety of the workforce, and that's not physical safety, or obviously that's very important to people, but actually it's that safety of their mental health at work, and how we get into a position where people are off sick because of work-related incidents, because that's the toll that's had on them. And usually in that chain is something that's fell down in terms of concerns not being handled timely, appropriately, behaviour that's ingrained is not dealt with, and these are usually the pots that form this pillar of concerns I get. Patient safety and quality is always where Freedom Speak Up was set up to listen to concerns about that. But we found, and this is not just Sherwood, but this is national and regional as well, Guardians have found that actually the patient safety concerns, is the least pot. So actually, because we've got lots of safety monitoring across the organisations in the NHS, actually that sort of replaced the need for people to, outline and talk through Food and Speak Up about patient safety and quality. But we do get them. People do come along and talk about direct safety issues. So that's another part that people talk about. And then other things people talk about is direct bullying, harassment. So the racism, sexism. Freedom and Speak Up is actively involved now in the sexual safety work that the Trust is about to roll out, being a portal for people to share concerns about that experience that they may have had in the workforce or are having. So these are all of the concerns that fit into those categories of bullying and harassment. What percentage get their expectations? Of course, it's very careful to manage expectations. We've got finite resources. We can't magic things overnight. We can't change people's behaviour overnight. But I think people that come to me are generally satisfied that either they've been heard and had that opportunity, or that some improvement has been made, even whether that's personal for them or whether, process, system, etc., or relationship has changed.
And I guess the thing I might say, Kerry, is quite often the outcome of the conversation isn't necessarily visible to the people because of the confidential nature or the processes that we need to go through, be those I don't know, change or HR processes or whatever. That's probably fair, isn't it?
Yeah, it is. It's difficult when, when you are, through an allegations process, or you're raising, those process that goes into a formal complaints procedure. Yes, of course, there's both parties that are entitled to confidentiality. However, there's always something you can do to assure somebody that some action has been taken, or that something's being looked at in an independent way. And when that process has come to an end, you're able to sort of feedback that it has concluded, without sort of giving, too much away. So I think that's important as well, to be able to communicate something, just so that person feels that, okay, something's come to an end, and that's been looked at.
Okay, Kerry, I'm going to move us on. I can't see
Yeah.
any questions that have popped in, but I'll chase Jess to see if they've got any questions. Put that in, and I'm going to move us on to Claire, who's going to discuss the digital confidence survey. Are we digitally confident, Claire?
So, really pleased to report that over 1,000 people have already completed the questionnaire survey. So really, really pleased with that, and that's recognising the hard work that my colleagues in NHIS have done in supporting users to complete the questionnaire. It would suggest that around 12% of our staff, our people, need that additional support. And that's what the idea of the questionnaire is, because as most people, I hope, know, we're heading towards procuring an EPR, electronic patient record, and we have a duty to equip our staff with those sort of fundamental digital skills ahead of what will then become their role-based training. So we think around 12% will need this. Well, we know currently 12% of our people need some fundamental digital training, and that's why it's really important. So if you think you are super wizzy and the next CNIO, and I would love to talk to anybody about a career in digital nursing or digital clinical team sort of roles, but please do still complete this questionnaire. It's really important that we understand the needs of our staff across all of the landscape. So you'll see the link there, so you can, if you are wizzy, you can scan it with a QR code. Jess is also going to put the link in. It's really easy. You might think, oh crikey, why are we being asked these questions? It takes about 3 minutes. And if you need support, message me, email me, stop me in the KTC, and I will either come myself to help you, I'll come and support your teams to fill it in, whatever you need with there. So as Dave said earlier, we've got the lovely Amy, who is our Digital and Social Inclusion Officer, is down in the KTC this week, and she's been supported by some and his colleagues. So we're more than happy to help you do that. But if you think actually I could do with a visit from my whole team, do let me know. And I think just pulling on some of the things you mentioned earlier about car parking, Dave, this is another example. So we're asking our staff to register online, but we're knowing that there's some training requirements there. So it just brings that all in a whole. So it's not all about the EPR, although a lot of it is around that preparedness.
Perfect. And Claire, so this digital confidence, I've got the so what question. So is this about us getting a baseline, or is this about actually targeting specific people, or is it a bit of both?
So I think it's a bit of both. So we don't know what we don't know. So we make massive assumptions, don't we? I say we as the Royal. So I use internet banking, so I must be digitally competent. So I think it's around having a baseline of where we are now, but also preparing our staff properly in readiness for working in a digital hospital. So those 12.5% that we're running at the minute, everything's gone onto a system where I can find out who needs what. So for example, I'm going to pick on Sally. So Sally's submitted her digital confidence questionnaire and highlighted that she needs some level 1 training. So level 1 training is about, you know, can I log on? Do I know how to navigate safely? Am I aware of any security issues? That sort of fundamental stuff, I would say. For example, you know, do I know what happens if I right click, things like that. So then I can go out to Sally, and this will be the next phase of the project, that will approach individuals that have identified their need fundamental skills training, and we will offer it in a couple of different ways. So we'll offer it face to face and one-on-one, or face-to-face small groups, or for those that are a little bit more advanced, they may want to do some online learning, but we'll be heavily using one-to-one and small group training.
Perfect. And I've got to fess up a bit. I haven't done my digital confidence survey, and so will it? I got an email. Will it get resent, or if I got to go on that link?
No. So we will do. So we started on the 16th of September. We've got a sort of drive until the end of October, and then we'll do another round robin. But certainly you'll see people, and you'll see members of my team who are all clinical, so we'll all be wearing uniforms out and helping you. So we know who hasn't done it. So we are going to be able to target them individually, and there's some, so no, I may be running a slight competition with wards, but currently in the leaderboard are clinical coding, who are something around 96.2% compliant. So big up to clinical coding.
Brilliant. Why do I rather think with I'm going to get someone knocking on my door saying,
yeah,
Oi.
I think that's very likely.
So many surveys, so little time. Okay,
I know.
So and Claire, you mentioned something, so it's got a long name. You mentioned something called the EPR. So what updates have you got for me on the EPR?
So we right, what updates have I got you on the EPR? So lots of people will have been contacted that are going to be directly involved in helping us to choose what electronic patient record we've got. It's still, the process of it is still a little delayed, but we were hoping to go out to the market last night to say, please, would you like to bid for our business? And I know that that's been slightly delayed, but we're trying to push that through. There's lots of resources. There's the internet page if you'd like to get involved a little bit on the EPR. So I'll pop that in, and there'll be lots of other opportunities. So digital ambassadors and other roles that we're starting to recruit to. So it's a little bit stalled, and we need a big prod, I think, and it feels a bit like we've been saying this for a long time.
Okay, so it's always good when I ask you tricky questions. So what's happened with our EPR? So it's a business case that's worth about £55 million to us. So we've done a business case. It's currently sitting with the Cabinet Office. So what happened was when there was the issues with government, change of government, they looked at the procurement process, and so the Cabinet Office are agreeing the NHS procurement process, and that's where we're stuck. So it's been approved by Frontline Digitisation, who supported. It's gone to the Cabinet Office, and we're waiting to hear. And we thought we heard yesterday, which is why I'm teasing Claire yesterday, but we haven't heard yesterday. We heard and then we didn't hear. But that's only the first step. But that does allow us to then, as Claire says, go out and start to invite the market to come and talk to us and to show interest, which is it's the first tangible step, I think. So if it goes fantastically, if we get it approved this week and we can go do that, there's obviously a procurement process we have to go through, and we have to be very squeaky clean about all of that. When am I going to have an electronic patient record, Claire, if all things go well from today?
I'd prepared for all these really difficult conversations you were asking me in the financial year of 26-27.
Yeah. Yeah. Okay. So about two and a half years, something along those sort of lines. So it's a long process.
That sounds an awfully long process, but yeah.
And the key bit is this is a huge change program for us across the organisation. It's going to change how each and every one of us works and interacts. That's why we keep bigging it up. Okay.
Yeah.
I'm looking for questions, which I can't see any in the chat. I'm hoping Jess is putting the questions in if they're coming in. Okay, I'm going to move us seamlessly, Claire, while we look for questions for you, onto Sally, who's going to give us an infection control update. Sally.
Afternoon, everybody. Yeah, so just a brief update from myself. As we're now going into winter, and we'll start to see our respiratory viruses increase. So it's just an update from us. So currently, our position in the organisation is we have 9 positive COVID patients and 2 positive influenza patients. We are monitoring that on a daily basis. Our patient testing hasn't changed from this time last year, so we are continuing to test patients who are symptomatic, and we aren't doing asymptomatic testing anymore. Those patients will be tested on admission in ED with point of care testing. If they develop symptoms on the wards, then we'll do the viral swab and send that for PCR to the lab. And we have got outbreak testing in place if we need to use that, which will be decided at the time of each outbreak if we get any. Fingers crossed there. We are starting to see organisations around us and their numbers increasing. So we felt it was quite timely to bring this information to yourselves. Just a bit of an update with regards to staff testing. So we do not require staff to do any testing. We don't require LFTs from staff on a routine basis. And one of the reasons for that is an LFT will only test for COVID. It won't tell you if you've got flu or RSV, and we can still pass those on to patients and staff. So it gives us a bit of a false sense of security if we're COVID negative, but we're still unwell. So if you are feeling unwell, you've got symptoms, then you shouldn't be coming to work from that perspective, which is why we no longer require a lateral flow for COVID. From a mask perspective, we are still monitoring. We have our escalations and our triggers in place for if we do go back into masks. We aren't in that position at this point, and that is monitored on a daily, weekly basis. It's monitored in the Infection Control Committee on a monthly basis as well, just to check where we are and whether we are in that position. So we'd have to reach 15 patients before we would step that trigger up to look at mask wearing again in the organisation. So that if staff want to wear masks and patients want to wear masks, then that's absolutely okay. And we have got masks available for patients and staff to do that. And that is entirely your choice. But at the moment, we aren't mandating that. Next thing I just wanted to touch on was vaccinations. So as a lot of you will be aware, the flu vaccination programme started a few weeks ago, and they are doing grab a jab sessions in KTC and over at Newark and Mansfield. And there are a lot of peer vaccinators around the wards that you're able to get vaccinations from. With regards to COVID, currently we aren't providing COVID vaccinations within the organisation. During November and December, there will be a bus coming to site to provide COVID vaccinations, and that information is available on the intranet. And also you can book one via the national requesting system as well. And that's my update. Thank you.
Perfect, Sally. So just for the absence of doubt, we're not routinely testing for COVID. No. As members of staff. If a member of staff thinks they've got COVID, they've got to just be sensible and do what we would normally do for any other infectious disease or any disease where we think if we feel terribly unwell, then we'd encourage them not to come to work. But if they feel all right, we encourage them to come to work.
Yes. Yeah.
Okay. And people can wear masks if you've if they wish. Obviously, we all get coughs and colds during the winter, and if people, particularly people working in offices, they might want to wear masks from that point of view, presumably. Is that fair?
Absolutely, yes, that's very fair. Yes.
Perfect. And just so I had my flu jab by just gently walking around the corridors of Sherwood Forest, and someone stopped me and just jabbed my arm without me even breaking stride almost. So that was easy. The COVID vaccine. So they changed the guidance relatively late. So originally the guidance was that health and social care workers weren't going to get an autumn booster, as we've come to know it, and then they changed it and said we are going to be allowed to have an autumn booster and part of the guidance. So we've been encouraged to do that. Now we don't have a vaccination centre any longer at Sherwood, so and giving a flu vaccine compared to a COVID vaccine is a different process. They are legally different, which is why you've got that little bit of confusion in terms of that. But the COVID vaccines are available in the across the community. Most of them are given by community pharmacists now. I actually booked online. It was dead easy, and I booked a time. I actually went on Sunday this week, and I went to the pharmacy, the Orchard Pharmacy down at the community hospital, and there were a few people there. I had to wait 5-10 minutes or so, and then I got my vaccine. It was really, really simple, straightforward, and they did all that. So that is available across the whole of the healthcare system. Of course, obviously there are other pharmacies available from Orchard Pharmacy, but I just thought that was quite convenient to go and do that. But I would encourage you all to have your flu vaccine. We know that flu is coming early and coming big because of the Australian flu season. We've seen that. We follow the Australian flu season, so we anticipate a big flu aspect, and we know that the circulating flu viruses, certainly in the southern hemisphere in Australia, are exactly what the vaccine protects against. So we think that the efficacy will be good, and it will nullify many of the impact of the flu vaccine. And the same for COVID. The key bit about COVID vaccination is it stops you basically getting it so ill you have to come into a hospital. And I would really encourage you to have all that. I think we're giving Moderna currently is the vaccine being given out in the system. As you can imagine, I checked when I was getting mine. Have I forgotten anything, Sally? Is that all fair?
No, I don't think you've forgotten anything. That's all fair. It's all good.
Oh, okay. So we've got some where to book your COVID vaccine in the chat. We've got flu vaccination clinics in the chat. We've got details on the bus. Oh, the bus. Yes. So one of the things that was the other thing. One of the things we've because we don't have our vaccination centre, one of the things we've asked to do, ask the ICB, our colleagues in the primary care system and the integrated care system, is to support us to bring a bus on site, and we've got a number of dates coming. We're trying to hope to get it there once or twice a week, but certainly we've got it for a number of dates already, and that will allow patients, visitors and staff to have COVID vaccines that will come. We're obviously exploring other options about whether we can maybe work with some of our local pharmacies to open up earlier and all of those sort of aspects, or open up later. We haven't made it much progress with that. That's still in consideration, but I'll just encourage, as I said, it's pretty simple to go and do, so I'd encourage you to go and do that just as soon as possible. Okay, not a huge amount of chat that I've got. So Claire's had to drop off. I can't see any last questions in the chat. What I usually do is I just drop off as the last question comes in, but can't see any last questions there. So I'll probably just thank Sally for the update, Claire for the update, and Kerry for the update. Quite a busy time. Lots of initiatives, lots of events happening. and obviously it remains very busy as an organisation with our emergency pathways, not helped by yesterday's bit of nonsense. So thank you all. Have a good rest of the day.